This dog is biting and tearing at itself, not because it's crazy, but because something incredibly tiny is living on and inside its skin. The itching can become so intense that the dog constantly scratches, licks, and bites its body. That the real culprit is not easy to see with the naked eye, and to find it, veterinarians have to carefully examine every part of the dog's body. The culprit is Sarcops scabiei, a parasitic mite that is only a few tenths of a millimeter in size. The mites don't simply stay on the surface of the skin. They also burrow tiny tunnels underneath it. Inside these tunnels, the mites continue to live, feed, and reproduce, causing their numbers to increase. The intense itching isn't caused only by the mites burrowing into the skin, but is also related to the immune response. The dog's body recognizes these foreign substances and triggers an inflammatory response, creating an itchy sensation that makes it want to scratch. At first, the signs may be as simple as a dog being slightly itchy and scratching more than usual. Commonly affected areas include around the ears, elbows, belly, and chest. The skin may then become red, develop crusts, and lose hair. One of the most common ways it spreads is through direct contact between dogs. Simply playing together, sleeping together. This is especially important in places where many dogs live close together, because one infected dog can increase the risk of spreading it to the others. It's not just direct contact that matters. The surrounding environment should also be taken into consideration, especially blankets and bedding. If you only treat the dog but ignore the places where it lives and sleeps, reinfection can occur, making the owner think the medication isn't working. Overall health can also affect how severe the condition becomes, especially in dogs that are weak or poorly nourished. Puppies should also be monitored carefully, because their bodies are smaller, and their health can be more vulnerable. When signs of itching appear, the dog should be taken to a veterinarian, especially if it keeps scratching or develops unusual hair loss. Because itching can be caused by mange, a veterinarian may take a small skin sample from a suspected area for examination, then place the sample under a microscope to look for signs of the parasite. Under the microscope, things that are far too small to see with the naked eye begin to appear. And that's when the veterinarian has more evidence to choose the appropriate treatment. When we see the mite under a microscope, we can truly understand how such a tiny creature can cause so much discomfort to a dog. The good news is that mange can be treated, but the type and dosage of medication should be chosen based on each dog's specific condition. A veterinarian may use appropriate antiparasitic medications depending on the animal's condition. In some cases, the medication may be applied topically or given through other methods prescribed by the veterinarian. Treating the dog alone is not enough. The owner also needs to thoroughly clean the places where the dog regularly sleeps, plays, and spends time. Blankets, bedding, and washable items should be cleaned regularly to reduce the risk of any remaining parasites. Kennels and living areas should also be cleaned thoroughly, especially if multiple dogs share the same space. After treatment, the owner should continue checking the dog's skin and coat every day, because recovery takes time, and the itching may not disappear immediately. With proper treatment, the skin can gradually heal and the fur can begin to grow back, but the owner needs to be patient and compliant. A healthy dog usually has more stable skin and a healthier coat, so regular care also makes it easier for owners to notice any unusual changes. You don't need to be a veterinarian to take good care of a dog. You just need to know how to recognize unusual signs and take the dog for a checkup when the problem persists. It's important to remember that not every case of itching in dogs is caused by mange, because allergies, skin infections. That's why getting an accurate diagnosis is more important than guessing the disease based on images found online. In particular, never use unknown medications on your own just because you saw someone else use them successfully. May not be suitable for another. Medication should be used in the correct type, dosage, and duration recommended by a veterinarian. Regularly caring for your dog's coat and skin can help you detect red areas, hair loss, or crusting early. Good care should also include proper nutrition, clean water, and a suitable living environment. If your dog is extremely itchy, losing hair rapidly, or developing skin lesions, don't wait until the entire body is affected before seeking help. When detected and treated properly, many cases of mange can be controlled and recover well. So, mange is not a death sentence for a dog. What matters most is recognizing the problem early and treating it properly instead of neglecting it. But mange is only one part of the story when it comes to dangerous diseases in dogs, because there is another disease that doesn't attack the skin. That is rabies, a completely different and extremely dangerous disease from mange, because behind it is not a parasite but a virus that attacks the nervous system. The rabies virus can enter the body through the saliva of an infected animal, especially when the saliva comes into contact. A single bite can create a pathway for the virus to enter the body, and from there it begins a silent journey. Instead of freely traveling through the bloodstream as many people imagine, the rabies virus can reach nerve endings near the site of entry. From the exposed area, the virus can travel along the nerves toward the spinal cord, and eventually reach the nervous system. When the virus reaches the brain, the problem is no longer just a small wound on the body, but a direct attack on the center that controls behavior. When the nervous system is affected, the dog's behavior can change dramatically, which is why the owner may feel that their familiar animal. Some dogs may become agitated, restless, or unusually aggressive, but aggression is only one possible symptom as the disease progresses. Some may become sensitive to light and their surroundings, and stimuli that were previously normal may now. Difficulty swallowing and fear or avoidance of water may also occur, but this does not mean that every dog that refuses to drink water definitely has rabies. When the ability to swallow is affected, saliva can accumulate around the mouth and create the appearance that many people commonly call foaming at the mouth. Not every dog with rabies becomes aggressive. Some cases instead become weak, sad, and less responsive than before. As the nervous system continues to be damaged, the dog may have difficulty walking or lose coordination. If rabies is suspected, the most important thing is not to approach or try to restrain an animal showing abnormal behavior. Instead of handling it yourself, keep a safe distance and contact a veterinarian or the appropriate authorities so the animal can be assessed and handled. The most important thing about rabies is prevention before symptoms appear, and regular vaccination according to a veterinarian's guidance. A vaccination given on schedule can significantly reduce the risk of rabies in dogs, so don't wait until a potentially infected animal appears if we're thinking about disease prevention. In addition to vaccination, controlling dogs when they are outside and limiting contact with animals whose. If your dog is bitten by an animal suspected of having rabies or comes into contact with its saliva, don't wait for symptoms to appear but contact a veterinarian. With rabies, the timing of post-exposure treatment is extremely important. If we put mange and rabies side by side, we can see that these two diseases are completely different in nature. One mainly affects. One is a parasite that can be seen under a microscope, while the other is a virus so small that special scientific techniques are required to detect it. The most important thing is not to be afraid of every disease, but to understand the unusual signs and know when to seek professional help. Observe your dog every day, from its coat and skin to its behavior and ability to move. Keep its vaccinations up to date and take your dog for a checkup when unusual signs persist. Especially don't ignore anything related to rabies. A healthy dog needs more than just food and love. It also needs protection from diseases that cannot be seen with the naked eye. From a tiny mite beneath the skin to a virus that attacks the brain, extremely small organisms can sometimes have very serious consequences. So, don't wait until your dog is actually sick before you start caring about its health. Prevention, hygiene, and early checkups always. Mange can be treated if detected and managed properly, while rabies requires serious prevention beforehand. If your dog has ever had mange or you had ever encountered a suspected case of rabies, share your story in the comments, and don't forget to follow the channel to discover more strange and important facts about the animal world.